Average Joe PT. We're here today to talk about neck trauma, all the different ways that can cause that neck trauma, whether it's from a car accident, whether it's from a fall, sporting accidents, or whether it's from literally just sitting down looking at your phone, or just sitting at a desk too long can cause all that tension in your neck. So I want you guys to stick around this episode, and Skully and I are going to show you some cool things. Stay tuned. So Skully and I, we're going to talk about today that neck trauma. And let's start out with just some basic anatomy of it. So whether we're talking about the lower part of the neck or the upper part of the neck, that pain is going to radiate from the top of that skull all the way down through all the different segments, as well as into your shoulder blade. So that's right, even the shoulder blade itself kind of hanging out here on the side here, those muscles running from the shoulder blade up to the neck can all give you pain. So that's the reason why a lot of times that pain just feels deep in the mid part of the back, and it's because a lot of those muscles run all the way from the top of the neck all the way down to your shoulder blade in the mid part of your back. And that literally can give you a lot of pain, and people tend to want to just push their fingers on that area. And sometimes that's okay, and sometimes that's not. If it seems to be giving you some radiating pain down your arm or into your elbow, you're going to want to ice that. You're going to want to rest it and probably give you some, anti-inflammatories, whether it's ibuprofen or whether it's Aleve or some other non-steroidal anti-inflammatory. You're going to want to do those types of things to try and reduce that inflammation in your arm and your neck. Now, if it feels like it's just in the top of the shoulder blade, the neck area, then you definitely want to go ahead and maybe put some heat on that and maybe use a tennis ball or some other type of technique to reduce that pain in that neck area. Now, if we're talking about pain down the arm, like I said earlier, definitely want to ice that. So I want you guys to go ahead and stay tuned because there's some crazy stuff coming up here. So let's talk just briefly, and I'm talking briefly about nerve pain. Now, we've talked about myofascial, we've talked about muscle tears and micro tears, and we've talked about all that stuff. We haven't talked the nerve damage that can happen when it comes to your neck. Now, all the muscles and tissue in that neck obviously are getting irritated and torn, but also we have to think about the nerves. So let's just pretend that we took one of these bones and just blew it up for just a second, and we look at all those nerves along the spinal cord that are coming out, and they're very tiny in the neck. Now, anytime that you get a lot of tissue that's inflamed, the nerves can get inflamed too, or get pinched from maybe a disc. And so when that happens, you're going to get a lot of radiating symptoms. Now, specifically, if we're talking about certain bones in the neck, let's say we're talking about way down here. Now, there's 7 bones that make up the spine in the neck. And let's say we're talking about numbers 6 and 7, that's very important because a lot of our movement looking forwards and looking up comes from that one segment. About 50% of all of our movement comes from there. Now, if we're having pain and it's numbness or tingling in our hands and it's coming, how do we know it's coming from that segment? Because each one of the nerves in the neck also talk about or distribute in our hands and our arms. And so if we're talking about that C6, we're talking about this area here, which is that C6 nerve. You might have some numbness and tingling in maybe your pointer finger or your ring finger, and that could be coming from the neck area. So needless to say, when there's a lot of muscle problems, there can also be some nerve problems that stick around with it when it comes to falls, motor vehicle accidents, sporting accidents, or just that looking down for prolonged periods of time. So I want you to stick around. We got just a little bit more. Now, when we talk about different types of neck accidents and traumas that can happen, when it comes to a motor vehicle accident, and that just thrusts you forwards, and that car gets slammed and hits real quick, that entire neck is moving at that speed of that vehicle until you get that stop. So we can get what's called whiplash. And what that means literally is when part of the neck gets whipped forwards, like on this guy, that neck got whipped forwards and then got whipped back real quick. Now you got some really tiny muscles across the base of your skull here called suboccipital muscles, and they're your nodding muscles, and they're very tiny, and when they get traumatized, they give significant amount of headache up and down your skull, and it might even feel like it's in your eye sockets, and you're going to want to ice the back of that area and definitely take those anti-inflammatories like the doctor says. The other big thing when it comes to a car accident is all those what we call active trigger points. There's two kinds. There's latent and active. And when those things get inflamed, those knots in our neck, those active trigger points, they start referring pain up the neck, up the head, down the mid part of the back, and then even down in the arms, just from that instant stretch forwards and stretch back, almost like a rubber band. And you have these things in that tissue called micro tears that can happen, where literally the muscle and tendons and tissue just kind of tears apart, and what we call the myofascial. That's a big word, myofascial, and you can have what's called myofascial pain because of that. And so I want you guys to stick around, look at some of these clips right now. So when we're sitting all day long and you kind of have this kind of like movement where you're kind of down like that and looking forwards, that's a lot of extra stretching and tension on all those neck and shoulder muscles looking down for long periods of time. And the last thing you want to do is stretch some more. You'll see that a lot. You'll see people that want to stretch those. Now, if you're already in this nice stretch position already, why would you want to stretch it anymore? That's crazy. You wouldn't want to stretch it anymore. You want to get yourself in a nice supported position. Just stay away from looking down for a while and just ice it for 10-15 minutes. And do that for 2 or 3 days, and you'll be surprised how quickly those tension type knots and pain and headache that's giving you goes away. So stay tuned. So Skully and I would love to have you guys part of our family. Wouldn't we, Skully?
Absolutely, be part of our family.
That's right, we would. And what we want you to do is hit the bell, subscribe. We try and bring content once or twice a week. We'd love to have positive, negative comments. We don't care. Bring them on. And if you guys want to stick around, we got some other information in here recently about different types of trauma, different types of treatments that you can do in your home to reduce that pain that you're having. But until next time, Skully and I always like to say, look up and keep smiling. See you next time, folks.